Imagine two children who have been born today. One grows in clean water, vaccines, safe roads, and smoke-free laws. The other one grows up without those protections. Before either child ever steps inside a hospital, their life expectancy is already different. So here is the real question. What really saves more lives? Hospitals or prevention? Stay here with me as we share the answer to this question, and we see what makes a difference in our lives. Hi, I'm Dr. Joshua Derito, a family physician focused on public health and cancer prevention. Here, we turn complex science into simple steps that you can use today. Today, we are answering this powerful question. Prevention or treatment, which really saves more lives? The heroism of hospitals. Let's start where the drama is. Hospitals are heroic. They stop bleeding, they open blocked arteries, they perform cancer surgeries, they deliver premature babies, they rescue accident victims. If you're in a car crash, you don't need a policy debate. You need a trauma surgeon. Clinical medicine saves lives dramatically, one person at a time, and it does so beautifully. But let's look at the quiet power of public health. Zoom out from the hospital heroism. Over the last century, global life expectancy has doubled. From 32 years in 1900 to over 70 today. What caused that massive jump? Mostly not hospital expansions. It was clean water and sanitation, vaccination programs, safe food systems, load safety laws, tobacco control, and maternal and child health improvements. Vaccines alone are estimated to have saved over 150 million lives in the past 50 years. Clean water transformed child survival worldwide. Public health works before diseases ever appear. It prevents crises. Hospital manage the crisis. Now, picture this. An ICU, monitors are beeping, doctors are moving fast, a life is hanging in the balance. Now picture something very quiet. A vaccination clinic in a rural town. Clean water tap installed in a village. Speed limit enforced in a busy road. Salt reduction in packaged foods. No drama, no applause, but fewer funerals. That is public health. Let's look at the Kenyan situation. Life expectancy has risen significantly from the year 2000. Much of that gain came from expanded immunizations, better maternal care, reduced infectious diseases burden, But now, hospitals are overwhelmed with complications of hypertension, diabetes, road traffic injuries, especially the motorcycles, stroke, and even kidney failure. Dialysis is well spread out, which is a good thing. It relieves suffering. But then, how did we get there? Many of these are preventable if we strengthened salt reduction policies, early blood pressure screening, physical activity promotion, and safe moving spaces, road safety enforcement. We have to figure out how to reduce the accident from the motorcycles and tobacco programs, illicit alcohol use, which is prevalent in every corner of this country. We would prevent the thousands of hospital admissions before they ever happen. That is policy. So what really saves more? Here is the honest answer. Hospitals save lives intensely. Public health saves life in scale. Hospitals rescue the individuals. Public health protects the population. Treatment pulls people out of the river. Prevention prevents them from falling in. And historically, the largest shifts in expectancy came from prevention. But here is the key. This is not a competition. It is a sequence. Strong public health reduces hospital burden. So we have to think, how do we control this illicit brews? How do we prevent these people from getting the chronic complications of diabetes? How do we prevent people getting hypertension? How do we get people to be screened for hypertension early before they get up into end-stage renal diseases? So, strong hospitals will help those who really need care. But the best system will need to combine both. Let's reflect on this. In my clinical practice, I manage blood pressure, I manage diabetes every day, but those many patients, they trace back to high salt diet, physical inactivity, missed screenings, tobacco exposure, illicit brews consumption, upstream risks. Public health fixes the upstream. Clinical care manages the downstream. The most powerful medicine often happens before the prescription pad. Think about it. Let me ask you. In the long run, what do you think will save more lives? Is it the hospitals? Is it the prevention? Or both equally? Comment below and tell me from which city you are listening from. Is it Nairobi? Is it Machakos? Is it Mombasa? Let's start a serious conversation. We need to take our public health seriously. We need to take prevention seriously. Health does not begin in the hospital corridors. It is in your house. It is in your home. It is in the town that you live. It begins with the policies that we have. It begins in the schools that we are managing. If we are teaching our kids to exercise, if we are teaching them to eat healthy, the roads, if we are implementing good road safety policies, homes where we are eating healthy foods, maintaining good social connections, avoiding excessive exposure to the screens. This is where real health is. And the communities that support safe water, safe environment, and good public health systems. Hospitals are heroes. Public health is the invisible shield. And if we want a healthier Kenya, we must invest in both, but never ignore prevention. Because the best hospital visit is the one that you never need. I repeat that. The best hospital visit is the one that you never need because you took prevention seriously. If prevention resonates with you, if you wanted structured guidance to prevent hypertension, diabetes, obesity, and long-term complications, explore the Health Insight 360 program at Wellness Health Services website, because upstream action is today. Prevent the downstream suffering tomorrow. Subscribe if you value science over hype. See you in the next video. I'm Dr. Delito.